Hello everybody, I am Pastor Philip Johnson. I'm a patient coordinator with Dr. Rick Sponaugle at Sponaugle Wellness in Palm Harbor, Florida. And we're glad you're taking time to watch this here today. And we have a beautiful woman with us here today to give us a story or personal testimony. And this is an exit video. This is your last day of treatment with us. And you've been with us now for several weeks.
3 months.
3 months.
Almost to the day, yeah.
Been treated. And you had a lot of symptoms that we're going to talk about here in just a minute. But I haven't, and I apologize. Tell us your first name.
Her name is Amy.
Amy. And Amy, what state are you from?
I'm from Kansas.
From Kansas.
Yeah.
Your story is incredible, and it's going to be of particular interest to some of the folks that are watching this. So I was the person that originally got involved in a conversation, actually from another center that called and talked to us about that. And they explained, and then I talked to your husband a little bit, and we were dealing with Parkinsonian type symptoms. And that's what you came to us for. So we want to jump in on that conversation so that those that are watching can get a pretty good idea of what you were experiencing back then and how those Parkinsonian symptoms were affecting your day-to-day life. I think you probably need to go back to this original story when it all started. So let's do that.
Okay. Went and helped as a volunteer with the Red Cross for Katrina.
Okay.
And I was responsible for setting up a dormitory in Mississippi that had been sitting abandoned for years.
Okay.
Full of mold, full of rat feces, full of just everything you could think of.
A toxin nightmare.
Oh, it was a nightmare. But we're in there cleaning with Clorox, you know, doing what we're told to be doing.
And what she's talking about there is that mold, for instance, when you use Clorox or bleach and you're what you would call killing the mold, while it's dying, if you want to say it that way, it's releasing a biotoxin, which literally can compromise the health in a big way.
Yeah, which it did. But, you know, we were doing our thing like we were being told to do, and one day there were some doctors that came in there in hazmat suits, and they said, get these people out of here.
My goodness.
And, you know, we still stayed in there and cleaned. We just said, oh, they're being silly, you know. Nobody thinks that mold can affect you the way it can. And so it was probably about a month later, my mom mentioned, she said, why are you dragging that leg?
Oh my goodness.
I said, what do you mean? She goes, you're dragging her leg. I said, you don't want to know. I knew something was seriously wrong. And so I went in for testing, and my first diagnosis was MS.
Okay.
And then they just said, no, this isn't MS. Her, you know, her brain scan has these white spots, but they're not quite in the MS format. So then they thought they found a brain tumor.
Okay.
Sent me to a brain surgeon. He was ready to operate, and I said, no, I don't want to do this.
Okay.
Third diagnosis was Parkinson's.
Okay.
Because that seemed to make the most sense. So for a whole summer, they had me trying all these Parkinson's medication to try to make something work. And finally they found something that worked. But it was a full summer feeling sick and tired and worn out. And okay, so I have Parkinson's, I'm on Cinnamon, and I keep increasing the amount, I'm up to, when I came to the clinic, I was taking 1.5 Cinnamon every hour and a half.
My goodness.
I mean, it was controlling our lives. I was bedridden, I couldn't move, people would have to come in and take care of me and bring me food, and it was just not a life at all. Speaking
to your husband, and you can validate this, but there were times when you literally, maybe only your head was the only thing, or speaking was all you were able to do.
Well, barely speaking. I mean, barely audible.
Just the whole body became rigid.
A whisper, yeah.
Yeah.
Yeah, and prior to that, I'd been very, very active. You know, realtor, very busy realtor. Very active in the community, did a lot of volunteerism with the Red Cross, with the Junior League, and some other organizations. So this was not me laying in this bed, and I knew something had to be done. So prior to that, backing up prior to being in bed for that length of time, I had gone to integrative health.
Okay.
Because I was, you know, the neurologist I was seeing was just, his answer was more medication. And that was never my answer.
Okay.
So I went to integrative health, and they said, yeah, I think we can help you. And they were doing some glutathione IVs and other IVs, and I just wasn't progressing, and they knew of the wellness clinic here in Florida, and they said, this is where you need to go.
Okay.
In fact, they said this is the only place in the world
My goodness.
that you can go. There's so many internists, so many neurologists that just don't even test for mold. They wouldn't know what to do if they had a positive test.
That's important. I'm glad you brought that up. It is very misunderstood or completely ignored to think that environmental toxins could be shutting the body down.
Sure.
It always becomes a brain infection, affects the myelin. Symptoms are very long of what it can do, from cognitive issues, memory loss, word recall, to the physical problems, the ailments that some of that you've been experiencing now for some time. From the time that you read Katrina until the symptoms started was months or a year?
Oh gosh, a month, within a couple months.
And that's another point that we often stress over the phone, that it doesn't take years of being exposed to mold. In fact, some people that are blonde-headed and blue eyes and so on, we talk about genetics. We do genetic testing here. A lot of the fair-skinned people genetically can't detox, and for them, sometimes just a matter of hours or a couple days being exposed to mold can bring on some pretty severe symptoms for those folks.
And I do have the COMT defect, genetic defect, which a lot of people here probably do have that. So.
Which affects your ability to naturally pull these toxins out of your body. Dr. Sponaugle years ago developed a detoxification drip that we do as part of our healing treatment protocol. And we're able to, with those drips, they bond with those toxins that are in your body, and then of course pull them on out of the body. And we have drips that can push the toxins, out of your muscles. Your brain, your brain's a very fatty organ, and it collects a lot of those things, which is why we suffer so much with brain issues, when we get these mold levels coming after us. So obviously you've had some good days. I've seen you have some wonderful days while you were here. Jogging, and you're such a happy person, and such an encouraging spirit all the time. So you've been a real trooper through your sickness long before you came here, and not wanting to stay in that bed and get out. And how do you feel now about going home? What do you think is going to happen?
I think I'm going to continue to improve. I think through KU Med, I'm going to be getting more drips and continue to improve. I might be back here in 6 months, who knows? But it won't be because I have to be. Yeah. It'll be because I want to be.
Some people come in for once a year for a little maintenance, once in a while. And so you feel like you really turned a corner on your health.
Absolutely. I feel a door opening.
Now, let me go back and just for a moment, and I don't want to bring up bad memories, but your worst case scenario before you came here, that paralysis that would set in, unable to move at times. How long has it been since you've experienced something like that?
I still have moments almost every day.
Okay.
Where there is some sort of paralysis.
Okay.
But they're much shorter moments. And I can, all of a sudden, it's just like a door opens in my brain and boom, I'm out, I'm moving. And it's that fast, it's just that quick.
And that's fascinating to talk about, because not only do we pull the toxins out, which are contributing to the overall failure in health, the toxins that cause so much problems in the body, but Dr. Sponaugle's research on the brain, understanding the brain, getting the brain chemistry balanced again is a very critical part for all of our patients, whether they're here for toxins, environmental toxins like mold, or whether it's Lyme disease, which also becomes a brain infection. So our goal with all of our patients is get that brain chemistry working again, pull the toxins out of the brain. It's the upper management to the rest of the body, and when it's working right, we see a lot of great improvements take place in the rest of the body.
Yeah, I just cannot say enough good things about him. I mean, he's just truly a genius when it comes to the brain, and the fact that the receptors play such an important part, and you know, my brain, so my dopamine levels would come back at over 3,000. Okay. And his point was, if you have that much dopamine in your brain, why aren't you able to function? I mean, it's because the receptors aren't receiving
working.
It. Yeah.
Not carrying things around the way they need to. So, That's a good point. That's a valid scientific point that you brought up. So that's the thing that Dr. Sponaugle does. Like I say, he does the best at. Why is this happening? Let's find out the cause. If your body is producing this, then why isn't it working? You know, why you're having the symptoms as if no dopamine was there, or as if your hormones are non-existent. You know.
Yeah, I mean, very impressive. So impressive that he will, at home, do mega doses of glutathione to try on himself before he tries on a patient. It's just like, you know, what doctor does that?
What doctors does that? And I haven't asked him this, but I don't doubt that he probably carried your file home with him on more than one night, because that's just what he does.
Yeah.
He'll dig into that file. He'll research. Every patient is important to him. We don't patronize someone when they say they have a symptom. You know, we want to find out what's going on. Let's find the cause of that. And we're not just trying to medicate those symptoms away.
Yeah.
We want to find out what's happening there. And so, well, we're very excited about the improvement that you've had here, and you're going back home, and that's a wonderful thing. And the kind words you said about Dr. Sponaugle and Sponaugle Wellness, and not because I want you to get sick, but we certainly hope to see you again in the future. And folks that are watching this again, what a beautiful testimony. A beautiful lady, her and her husband are here, and been a great part of our lives for the last couple of months. Any closing comments you want to make to anybody that would be watching this video?
I would just say, do not hesitate to make an appointment. At least, you know, talk to somebody here, talk to Dr. Sponaugle, some of the staff, anyone, just to see if this is the right place for you. Because if it is, this is where you need to be.
Thank you. So following up on that, again, I'm Pastor Philip Johnson. I head up the patient coordinator department here for Dr. Sponaugle. Me and my staff, if you want to call us, one of us will take your call and spend time on the phone with you discussing your symptoms, what you're going through, and if we are the right place, the right fit for you. And we'd love to hear from you, so please don't hesitate to call. Thank you, and God bless. Tell me how you feel right now with what you just did.
I feel like a new person. I feel like for the first time in a very, very long time I have a full stomach and I can move. And not be rigid and not be locked up and be able to speak clearly and just feel great, euphoric.
Now you were just walking, actually you did a little jogging.
I did a little jogging, yes. Didn't want to overextend. I could probably do more if you want to see it.
That was wonderful. I so appreciate you doing that for us. Thank you.